Welcome to the Friends of NPACE podcast, brought to you by Haleon. As a leading global consumer healthcare company, Haleon is dedicated to delivering better everyday health with humanity. Known for trusted brands like Advil, Excedrin, and Voltaren, Haleon leverages science, innovation, and human understanding. Haleon is proud to collaborate with NPACE to educate healthcare professionals about our pain portfolio and the latest healthcare information. For more information, visit www.haleonhealthpartners.com. Hello, everybody, and welcome back to the Friends of NPACE podcast. My name is Josh Plotkin. I'm the NPACE Chief Operating Officer, and today I have my co-pilot, Terry Schmidt, Executive Director and Family Nurse Practitioner at NPACE. And we have a fantastic guest joining us today. It's Melissa Carter. She's a board-certified family nurse practitioner and founder of 2U Pediatrics. And 2U Pediatrics is a mobile pediatric clinic serving families in Massachusetts and southern New Hampshire. Melissa began her career with an undergrad degree in nutrition and dietetics and worked as a registered dietitian at Boston Children's Hospital before returning to school in 2012 and then returning to Boston Children's to work in the stem cell transplant unit. Melissa left Boston Children's in 2025 on a journey to rethink how pediatric care is delivered, bringing personalized, urgent care directly to children and families wherever they are. Melissa is raising two young sons and enjoys them, her family, and traveling. Melissa, we thank you so much for joining us today. How's it going? Thank you for being with us.
Thank you for having me. Very excited to be here.
Excellent. So Melissa came to us by way of some other NPACE colleagues that she's had friendships and relationships with. So a big shout out to Beth Williams and Jess Kemp, who were part of our team and helped make this connection with Melissa. I'm going to hand things over to Terry, who will get us started on our conversation today and sort of getting things rolling from that standpoint. So Terry, take it away.
Yeah, I'm so excited you're here, Melissa. As a past peds nurse, a peds urgent care nurse, and then I apologize to the audience. I've had a cold, so if you hear me cough, that's going to be why. But also as a pediatric urgent care nurse practitioner for years, and I know how devastatingly busy cold and flu season. It was like from December through March. We could see 100 to 120 patients a day with just two providers. That's how crazy it was. And knowing what it takes to pack up a child and put them in the car or when everybody's sick, I'm just so excited that you're here to talk about other options for care. So I would love to start with like the need. What did you see? Why did you start this 2U Pediatrics?
Yeah, so as you said, pediatric urgent care, I think one of the major things that I found when my two boys were sick was, the time that they were sick and, the days of the week that they were sick. So my boys, when they were younger, they often got sick on a Friday night at like 5 o'clock or on a weekend. And my husband and I had relocated when my boys were young back to southern New Hampshire. And while the pediatrician office that we were go to the bringing the boys to is fantastic, they just did not have much availability when it came to sick visits, even during the middle of the week. It was really tough to find a place to bring them when they weren't feeling well, or it was, 8 o'clock at night and I was bringing them to urgent care or to the emergency room. And I found as though when I was talking to other parents that this was really a major stress for families, especially, like you said, in cold and flu season, when they were utilizing the emergency room, not for necessary emergencies, but just because they had no place else to bring their child when they had croup or they were worried about an ear infection. And so I just started talking about this idea with, fellow parents and some friends and other providers, nurse practitioners, and no one really thought it was a bad idea. Everyone kept saying, "This is great. Why aren't you doing this?" And that's kind of the fuel to the fire.
No, I love that. you have a family practice degree, right? Like I do, but with a peds background. And there's something to people who have a peds background who can respond to pediatric illness. Like it's knowing how to hold someone while you're looking in their ear, or how to get a throat swab without being vomited on or completely traumatizing someone, or an RSV nasal swab.
Yeah.
Um, and they're just not like big adults. And I find so many adult providers terrified of anyone that is under 100 pounds. So I love that you
Yeah.
you do that. What do you think is the biggest challenge, do you think, for families trying to get timely pediatric care? Is it like lack of providers, or is it, like you said, the hours?
Yeah, I think especially, where in my community, I think that the hours, trying to get an appointment and also just pediatric specific care. I think around Boston, there are a few more options for pediatric specific urgent care, but I was finding up in, my area that there's generalized urgent care where, like you said,
Right.
there might be a provider that is comfortable with pediatric patients, but there's more often times there's someone that is mostly seeing adults and then can, as a family practitioner, see pediatrics, but that's not their comfort level. And so, and that's one of my joys is really, seeing the kiddos and trying to make them comfortable and trying to make life a little bit easier for parents. And that's one thing that really also was an influence in the van itself. When I worked at Boston Children's Hospital, they have child life specialists, they have treatment rooms. They really try to make the experience as enjoyable as it can be for a sick child. And children, when they're not feeling well, they still want to play. They still want to be children. They still want to, have two cars that they can, bang together. And I found that after COVID, when I brought my two children to the pediatrician's office, it was so sterile. They took away all of the magazines, all the books, all the toys, everything. There's no music, and they were just terrified to be in that environment. And so my goal with the van is, to make pediatric care more, convenient for parents, but also to make it more comfortable for their children, where I have some toys that I sterilize after every visit. I have the stickers, I have popsicles if it's okay with the parents. And those little things go a long way when it comes to making them comfortable for their next visit so that they're comfortable coming back or going back to the doctor's office.
I love that. You kept us patient focused in all of that. That's why they're there. I really think the adult providers would get a lot farther too if they would do stickers and suckers. Not gonna lie. I
I
really
keep saying that I need to reach out to Johnny Pops for a sponsorship because the Johnny Pops popsicles, I always have like a couple of boxes of those on the van, and the kids get so excited about them and the different flavors and the little variety here and there. And so it goes a long way. Some background music, if they get to choose a song to put on when I'm listening to them or swabbing their throat, it's more enjoyable for everybody.
those are great tips and hacks. I love that. Johnny Pops, if you're listening. Melissa's
Yes.
looking for a band sponsor. Josh, I'm gonna let you get into more of the ops of how this happened.
Yeah, absolutely. Melissa, I think you spoke to why it's important to sort of bring the clinic to the families, and obviously from what you just spoke to, the experience that you're bringing is different than what folks are experiencing when they do go to a urgent care, the doctor's office. It's sort of the traditional venue. Um, but what personally for you in the clinic sort of made you say, okay, this is something that I need to do? Was it your own experience? Was it your friends that were going through similar experiences? And obviously you worked at Boston Children, so you were in an environment that cared for children. So where were some of the things where you said, this is a need that needs to be met?
Yeah, so I loved working at Boston Children's. I was, as you mentioned, in the stem cell transplant unit and there for 10 years. And the past few years prior to leaving there, I had stepped up. I was the lead nurse practitioner for 12 other nurse practitioner and PAs in our group. And with that leadership role, I felt as though while I really loved the role and appreciated the strengths that I gained with that, it was also stepping a little bit away from patient care, and I felt as though that was where I really thrived as a nurse practitioner, was, the patient care aspect and just really interacting with patients and families. And I started to miss that a little. At the same time, I was spending a lot of time commuting, driving from Southern New Hampshire to Boston, and I loved children's, but as my two boys were getting a little bit bigger and I was spending more time commuting and more time in the city, I really just started to reevaluate like whether or not this thoughts that I had that was more just, like a conversational topic that I would have with friends and family. Um, my husband said, you keep talking about this at every wedding we go to, every family
Yeah.
event we go to, you give me a glass of wine and I'm going to talk about my business idea and try to advertise it. And what I said to Terry before you hopped on, Josh, was that I have a bookmark and it said that if you can't stop thinking about it, don't stop working for it. And it really stuck with me in terms of, I'm only in this life once, so might as well see if I can make this happen and see what would I need to do to make this happen. And
May
yeah, and
no,
just a
keep
little,
going.
yeah, just a note on that too. So I at the time, I'm familiar with NPACE, and um, I think Beth Williams had mentioned to me the company Duet, which Wendy Wright was working
Yep.
with. And so I ended up reaching out to Wendy Wright and also to Duet and just to saying, I'm a nurse practitioner. I'm really interested in launching this business. I'd love to chat with you guys. And so about a year and a half ago or so, it was about a year prior to launching, I was able and lucky enough to get set up with the Duet team, and I started working with them, and they were incredible in terms of you know, joining forces and giving me some more support in terms of logistically how I would make this happen.
We love how the universe comes together and brings N-Pace relationships and our partners all together. So Duet's fantastic. And to any nurse practitioner or advanced practice provider that's listening, if you're interested in starting your own business, Duet is absolutely a fantastic resource to be able to go to, as Melissa just mentioned. So, and they're right on our website. And that's fantastic, Melissa. It sounds like this idea came from you and your experience, and then evolved to having that conversation and sort of getting the community support to actually launching, which is absolutely fantastic. I want to ask you, how do you see a pediatric mobile care unit changing the relationship between families and the health and you as the healthcare provider? How do you think that changes things compared to sort of the typical environment?
Yeah, so a few families have called me and for different reasons in terms of their child was sick, and they might have been able to get an appointment at their pediatrician's office, but their child did not have the best experience at the last visit that they had gone to, or their child might be, have developmentally, be on a different path, maybe on the spectrum a bit. And so they were just bringing that child to the doctor was a very stressful experience. And so, when I've come to those visits and to see those patients, one of the things I do is just, and I'm able to do with this, is to allow a little bit more time for them to settle in, and, just to sit on the van and play for a few minutes. A lot of the times I have my toys, I have my books, I give those to the kids, and they're able to just hang out for like 5 or 10 minutes instead of me, immediately coming at them to swab them or to, listen to them or to look in their ears. And so it really just gives a little bit more time for, a pediatric rapport in some ways, and also time for the parents, the mom or the dad or the caregiver, just to kind of settle in and you know, we can chat for a few minutes about really what's been going on, and that's when I get the history. And it's been sometimes with those visits, it's more talking than doing, but I've had a few families where they've called me again to come back because the child has requested me. You know, they want the woman with the van coming, um, which is it might be because of the popsicles, but but it's, you know, it's that's the best feedback that I could have. You know, is the other day I saw twin girls who I had seen before, and when I pulled up, they were both in the window and they were jumping up and down, like, and it was just so fun to see this response, you know, is really just, I want it to be, I know going to the doctors and going to the, you know, urgent care is not a fun experience, but I think it can be a little more enjoyable than we make it a lot of the times in the community.
Yeah, I'm not sure if I've ever personally jumped up and down to go to the doctor's office, but if you were rolling up with popsicles outside my house, it,
Yeah.
it might be a bit of a different situation. So that's fantastic. I think I want to talk more about the visits and when you do roll up in the van and what that looks like for the family. So sort of walk us through the stages that a family will go through to book an appointment with you, and then what sort of transpires from there. How many days out should they be booking? When you do get there, what does the visit typically look like, and what might be some differences that you have available in the van when you're getting there compared to the traditional setting, or is it sort of the same exact sort of services that you would expect to see?
Yeah, so I've been running for about 3 months now, so I'm learning some things along the way. But right now, the way the visits will go, so most of my visits are same day. If anything, like overnight, they might request an appointment, but you can request an appointment at any time. I just have an hour or so leeway so that, you know, if it's right now, you know, say if it's 12:15 in the afternoon, I you can't book a 1 o'clock appointment. I just need a little bit of time to figure out where I need to go and to get my supplies ready. So when a family can request an appointment, then I have the ability to review the visit reason and to either accept or to, you know, contact the family if there's a question. So for instance, if they have a laceration and they're worried about getting stitches, you know, I can have a conversation saying, you know, oh, I have Dermabond, so I can do the glue, but I'm not suturing at this time. So let's talk about this laceration and whether or not, you know, you do need to go to the emergency room or I can see you. So there is some screening and triaging that's involved for some of the visits. Other visits I just can accept. And typically what I do is we'll send a confirmation text message when I'm either on my way or letting them know what time I'll arrive, so that they know when to look for me and when to see my van kind of pull up in their driveway. And then when you know, I do arrive, I give, you know, a few minutes, like just let them know, take their time, come out. They can bring other children if they need to. I've had families bring like a baby monitor if they have a child that's napping inside, and you know, I'm parked really close to the house. And so they come onto the van, and it's heated right now at this time of year. I have a pretty good heater. I got my van from a company that does mobile medical units out in North Dakota. So they have pretty good heat system set up, air conditioning for when the winter hits. And as I mentioned, you know, the child, usually I'll try to set them up with some books and some age appropriate toys, have some music playing in the background and make them just feel comfortable while I gather history from the parent, or from the caregiver, and we just kind of chat for a little bit. And then yeah, after gathering the history and kind of really getting a sense of what's going on, I do my physical exam, we determine whether or not any testing is needed if it's a sick visit, or if any medications or interventions are needed. So for right now, for first dose medications, I have, you know, nebulizer treatments like albuterol and saline. I have dexamethasone or Decadron, which I've been doing for croup, especially for, you know, those evening calls, 7 p.m., 8 p.m. when that barky cough starts. And it's terrifying as a parent to have hear that cough later on in the evening. So I have the steroids where I can do a first dose of Decadron. I have Zofran available. I know that emergency rooms and urgent care are really moving away from IV hydration for children just because the placement of an IV itself can be pretty traumatizing. And so I have Zofran available for first dose just to give them hopes of, having them hold that down and then do some oral rehydration as well. I also just ordered amoxicillin since it is the most common antibiotic that I'm using for ear infections, for strep throat, even for community acquired pneumonia in the younger children. And so I'm excited to have that. That will be arriving, I think, tomorrow. And then I find sometimes, I'm seeing families once again in the early evening, but their pharmacy might close in an hour and they're just stressed that now they have to go to the pharmacy or the pharmacy might close and they won't be able to start antibiotics until tomorrow. So that'll be another first dose medication that I'll be able to provide for families. And then otherwise, it'll be interesting to see what services will be more popular come spring and summer. I do have minor injuries, I can do splinting, wrapping, and minor lacerations, like I mentioned, to dermabond, tick removal, those other kind of non-cold and flu season interventions.
It's absolutely fantastic. It pretty much sounds like any sort of pediatric issue that might be going on that the call can come to you. And, if you're able to treat it, you're going to be able to roll up and help out the family and the child. And if not, you certainly have the resources and places to refer them to, which is great. I want to ask this final question, and then I'll hand it back to Terry to continue the dialogue. But is it just you that's coming? Do you have a support staff? What does the
Yeah.
team for the van sort of look like?
The team is just me for right now. Yeah. I have actually had quite a few, friends, fellow coworkers, practitioners that have messaged me, and that, I think when I am ready to hire, hopefully in the near future, that um, uh, I'll be able to, hire at least another one or two nurse practitioners or PAs or providers of some sort. But I felt as though, I needed to prove my concept and to figure out what my schedule really is going to be. I have an incredible support system up here, my husband, my in-laws, and my community itself has been really wonderful. And so right now, I'm pretty much on call every day is really how it goes, 7 days a week. But what's really nice is that in between that, if I only have one or two calls during the day, then I get to be around my family and be with my boys and take care of other business type things. And so it's during the weekends are really the busiest, as you could imagine right now, and then the weeks can be hit or miss, but just me to start.
Excellent. Well, we certainly wish for continued success and growth, and hopefully some additional providers to join you soon. It's absolutely fantastic what you're doing. Terry, I'm going to hand it back over to you to continue on with a few final things with our conversation.
I could just sit and listen to Melissa talk all day. This is just fantastic. Um, you and I talked a little bit before the show started recording about just fears of starting a practice. I think that's the biggest thing that's holding me back. So, talk to me a little bit about what it was, what your biggest fear or concern was in launching, and how you kind of overcame that.
Yeah, so a few big fears. Of course, leaving a job that I had, benefits, and I'd been in the Boston Children's system for almost 20 years. And I still wasn't ready to fully, I'm still in their system per diem, and I still do occasionally pick up a shift here or there, but that was, a big fear, was leaving a steady paycheck and leaving the support that I had there and going out kind of on my own for sure. Um, the van itself, actually, had a few people ask me like, well, do you need the van? Can you just go and do home visits? Because there's people that do home
Mm.
visits, and why do you need the van? Why do you need to take a bank loan out for the van? Because that's what I ended up doing. And it just was my vision. It was I could not picture myself doing this without the van. The van itself was a safe space. Like I said, it was a place where I could have all my equipment, but I could make it a place where they wouldn't mind going. My two boys, they don't mind going to the dentist because the dentist has the TV on the ceiling, and
Mm.
they get balloon animals every time they leave. Like, they don't mind going to the dentist. I thought if I can make my van similar, I think that actually would be a nice place, a nice safe space for children and for parents. And so that I think, when I said I was getting a van to go see sick kids, it didn't really, I think people needed to see it before they actually really understood what I was doing. And really just, was I going to be busy enough? I think that was um and still is a big fear, where I don't know what's going to happen. Yesterday, for instance, I didn't have any appointments at all until 5 p.m. And then I had two calls. And so, every day is kind of like, oh gosh, is this sustainable? Is this going to be? And I think just being creative with what I can offer, and other services that I can do. I'm going to, like for instance, probably going to add sports physicals,
Mhm.
and camp physicals, as well as concussion evaluations to my repertoire, to my services as well. And just kind of looking at things that I can do to help support the community, and other reasons why they might be going to urgent care or to the emergency room, besides cold and flu season. So those are some strategies I'm looking at right now, and that I'm finding is you know, um, necessary when you have a small business.
Yeah, I'm glad you said that because that leads right into the next thing, which is just financial sustainability. And Josh and I know running a business day to day that sometimes we live in that same world. Um, what did you do, or what approach did you take to just making your own business financially sustainable? Um, and what were the benchmarks, maybe?
Yeah, so my husband is actually works in finance, so
Oh,
he's my CFO for the business, unofficially or officially, I guess. But that's really helpful in terms of projection. Duet was once again helpful in terms of, looking at some financial projections. And then really, doing a lot of research on, do I take insurance? Do I do cash pay? What is insurance reimbursement for a pediatric home simple visit? Is that really a sustainable model? And to me, because it's such an unfamiliar concept, I think right now it really wasn't. So right now, what I'm doing is, cash. Or basically not accepting insurance, trying to make a price point very feasible for families, which so far has been well received, where most visits are $150, which is what a lot of families will pay to go to urgent care or to the emergency room. And, I'm coming to them and providing that, a different, more personalized service. And so a lot of it was that. And then, how can I schedule my days, and how many visits do I really need to um, for my overhead? And my overhead is really the van, and then supplies have been coming and going here and there, kind of reassessing those. But for right now, it's really just getting through cold and flu season, making sure that I can still have at least, for now I'm happy with 3 or 4 visits a day, if I can have that. Some days are a little slower, some days are a little busier, but um, I think that it'll be, I'm a little anxious about the growth, but I'm, I haven't heard any negative feedback so far. And so I think that
sure.
that makes me feel pretty optimistic about the future.
Yeah, no, I appreciate your honesty and vulnerability in that. I think that's all of our biggest fears in going out on our own is just how will we make ends meet. But there is such a need for healthcare across the board. And it doesn't seem like there's a plethora of new providers anywhere, new clinics popping up. So what you're doing, look, it's going to be poison ivy and sunburn season before long
Yes.
also. So there's that, and eczema and
Yeah.
allergies. There's always a thing. What's the one piece of advice that you would give someone else who's considering this, launching a mobile unit or an unconventional type of practice, maybe not a brick and mortar?
Yeah, I think reaching out to some there are people doing what you're doing in it, even though it may feel like nobody is. For instance, I just had a meeting late last week with the mobile health map from Harvard Medical School. They have this whole network of mobile medical providers across the country, and they're doing, benchmarking and finding all kinds of supportive data on how many emergency room visits are spared and what these mobile clinics are doing, and every mobile clinic might be a little bit different, but I didn't really know that this even existed until I had my own mobile medical unit. So, whether or not you're interested in doing functional care or aesthetics or adult urgent care, there's somebody that is probably already doing it or thinking about doing it. And if you can find your network, your support group, for lack of a better word, I think that will, fuel you to, continue to grow the idea and kind of bounce those ideas off of each other. I have a few other woman-owned small businesses in the area. One's a lactation consultant, a pediatric physical therapist, and a pelvic floor physical therapist. And we all went out to lunch the other day just to kind of support each other and kind of talk about businesses and what to do when it's busy versus when it's slow. And then I also had a virtual meeting with another nurse practitioner in Minneapolis who's doing almost exactly what I'm doing, minus the van. She's doing pediatric home care visits. And so connecting with her and seeing what's working for her and where I'm struggling, there's finding that community. I think it can be so isolating or feel so isolating if you decide to start your own business and to go out by yourself as a provider. But I think what you gain so much strength by networking with these other providers that have done it, and it's all, then you strengthen each other, and only good things come from that.
I love that you shared that. So yeah, finding community, right?
Hmm.
Okay, speaking of finding community, what a beautiful segue into wrapping this up. How do people find you if they need you, whether for care or to find you as their NP mentor?
Yeah, so on my website, you can find my business phone number, which is HIPAA compliant if needed. My email, so it's my business website is toyoupediatrics.com.
Okay.
It's spelled out. TOYOU and then pediatrics.com. I'm also on social media on Instagram and Facebook, both under 2U Pediatrics. And my email is very simple as well, melissa.carter at 2U Pediatrics. And so I'd be happy to, reach out if anybody has any questions. Just email me. I had an NP student actually reach out to me and asked if I would precept. So, even things like that, it's fun to talk about a little bit since it's a little non-conventional.
I love that. Everyone's looking for a good preceptor. They just have to be willing to be on call with you.
Exactly,
That's the
exactly.
thing.
Are
There's
you
no set.
ready to roll with me in the van?
Right? Absolutely. That would be amazing. Um, Josh, do you want to ask anything else? This has been so great. I love that she tied it into duet. We love duet so much. And Wendy and Beth, just great people.
No, I mean, I think that for me, it's is a person who's thinking about having, children in the near future, that to know how different care options are there for your children. And obviously, I'm not at that stage yet, but plenty of friends that are there. So, to be able to refer that. There's so many ideas in our conversation that we've had today, Melissa, where like where those slow times are as seasons change, where from a business standpoint, and how NPACE might be able to help. I think there's ways for us to continue the dialogue in that format as well. So just really appreciate you coming on. It's always fascinating to learn about new care options, and what you're doing is unique. I don't there is not too many folks, but I could see 2U Pediatrics having, a dozen vans rolling around New England in the next couple of years. And so,
That's right.
um,
That's the
you
goal.
know,
I would love that, just
ec-
to have like the South Shore, the more rural New Hampshire,
Oh,
that'd be great.
excellent. And
we spoke it
to
out
be
into the universe here. Good job, Josh.
from my lips to wherever it goes. Melissa, really appreciate it. As you just mentioned, 2upediatrics.com is where you can find everything on all the resources that Melissa has. To our audience that tuned in today, we really thank you for doing so. A few things to wrap up the podcast here. As always, we want to make sure you're checking out npace.org for all things NPACE. Our upcoming events are there that are live and virtual. We have a virtual pediatric conference taking place in September, 2 days on all things pediatrics. So, Melissa, hopefully we'll have you be able to join us, and we'll add this podcast as a sort of pre-resource for folks that are attending that conference for sure. All of our on-demand products and opportunities are at learn.npace.org. We certainly have a handful of pediatric programs there. We are ANCC accredited, so you'll be able to earn your credits. And we do have several programs that offer CME credit as well for our physician assistants and associates. So once again, npace.org for everything you need. Melissa, thank you so much for joining us. Terry, it's always great to jump on the podcast together. That's going to do it here on this episode of the Friends of NPACE podcast. We will see you next time. Thank you, everybody.
Thank you so much.